Kitchener Today with Brian Burke on 570 News.
Last time I needed a sick note was some point last year. I needed a sick note. So it is something that I'm not going to say it's controversial or anything like that. I mean, sick notes are sick notes, but do we still need them? Mike Schreiner is the leader for the Green Party of Ontario and MPP for Guelph. He joins me now this afternoon. Mike, I really appreciate you joining me this hour.
Hey, Brandon. Pleasure to be on, and I wish Brian well, and hopefully he recovers soon.
Yeah, that's the hope, and that's the plan, that he recovers fairly soon, so nobody has to hear me anymore, and everyone could just hear Brian.
Well, and let's hope he doesn't have to get sicker by going out and getting a sick note to prove that he isn't feeling well.
Yeah, and that's the thing, and that's what what you wanted to talk about today. I mean, why revoke sick notes?
Well, to me, requiring sick notes made no sense prior to the pandemic. I mean, to ask somebody who is sick to go to a doctor's office, pay $20 to get a sick note and possibly get other people sick made absolutely no sense. But it's downright dangerous in a pandemic to ask people to get a sick note to prove that they are not sick. That's why temporary measures to not allow sick notes were brought in, but they expire in January. And I think it's important to permanently get rid of sick notes and show the respect to workers. We're all saying workers are heroes during this pandemic, and I absolutely agree. And let's show some respect to workers by trusting them when they say they're sick.
Now, I know you were talking about this pre-pandemic, but is this prompted more so now by the pandemic?
Absolutely, it's prompted more so by the pandemic. I mean, most public health officials are saying we're headed into a second wave, and let's hope not. Certainly, we're going to do everything as a province to work together to prevent that from happening, or at least prevent it from, spreading like it did earlier this spring. But to ask people to go get a sick note when we're telling them to stay home or we're telling them to isolate when they have symptoms makes absolutely no sense. And I can tell you as a longtime small business owner, I had a good working relationship with my employees. I never asked them to provide a sick note because, quite frankly, I didn't want them to go out and get other people sick getting the sick note.
And I guess you could answer this question, I mean, as to, because you were an employer for that matter, I mean, how is it going to affect employers by not asking for sick notes?
Well, I think most employers have good relationships with their employees. And certainly if somebody, is clearly abusing this, time after time after time, then you obviously have another issue with that employee that you need to address around absenteeism. But requiring a worker to get a sick note when they're sick makes absolutely no sense. It didn't make sense prior to the pandemic, and it is downright dangerous during the pandemic. And I think most reasonable employers understand that.
Now, and I guess let's talk about that absenteeism there that you just mentioned. I mean, if someone is perpetually sick, I mean, shouldn't there be some sort of proof of it, especially if it's, actually telling the truth?
Well, you know what? Then other issues need to kick in terms of short-term disability, for example, some sort of leave, issues around absenteeism. But routine sick notes make absolutely no sense. And, we've had so many healthcare professionals say prior to the pandemic that it didn't make sense to require sick notes. And certainly during a pandemic, it doesn't make any sense.
Now, I mean, you just mentioned there as well, I mean, when it comes to, I guess, like short-term disability, but wouldn't they require some sort of documentation for that?
Yeah, but that's different than a routine sick note, to be quite honest. And so, there's different processes for that. Here's the bottom line, Brandon, is we keep going around saying workers are heroes, especially during this pandemic. And, I can't tell you how many people I know who went to work and sometimes in, kind of frightening and dangerous situations during this pandemic because they want to do their job. They want to serve people. They want to get goods to people. They want to be good employees. By far, the vast majority of people are like that. And then if they do get sick, to require a sick note, I think disrespects those workers who we are calling heroes. And so let's treat them like heroes. And I think one of the first steps in treating them like heroes is to say, you know what, when you're sick, stay home. Don't go to the doctor's office. We're going to trust you and get well.
Mike Schreiner is the MPP for Guelph and leader of the Green Party of Ontario. We're talking about ridding away of routine sick notes and revoking sick notes altogether, as was proposed, I believe, as was rather put back into the Act back in 2018, if you don't mind, if you can correct me there, Mike?
Yeah, that's right. So the previous government did get rid of sick notes, and then the current government brought them back. And temporarily, with all party support, it was one of the things I was advocating for at the beginning of this pandemic, to temporarily not require sick notes. I mean, at that time, everyone was saying if you're showing any signs of symptoms, quarantine, self-isolate, don't come in contact with other people. And so in that case, it was downright dangerous or potentially spreading the virus if you require your employees to get a sick note. That temporary suspension expires in January, and I think most public health experts, and I've talked to employees and employers, I've consulted with a number of people who think, it just makes sense to treat workers like heroes and say, we're not going to require you to get a sick note. Let's make that permanent.
Now, here's I guess the sticky situation. I guess as an employer, because I've worked closely with employers before, or my employer before. I mean, it's not that I don't work with them closely now, but I'm saying even in the past, there would be this perception to some who offer sick days or just no sick days at all. They would kind of abuse that rule. I mean, just calling in sick just for the sake of calling in sick without any sick notes required or anything like that. I mean, I worked 5 years in grocery, and I saw people do this all the time, where they just call in sick just because they felt like calling in sick. I'm wondering, do you find that without the sick note rule that would get abused?
I don't think you're going to see a lot of abuse. There wasn't a lot of abuse of sick notes in the past. And certainly if there is abuse, then you have other issues with your employee that you need to be addressing that go far beyond sick notes. The vast majority of workers, want to go to work, and will not abuse this. And so why are we asking the vast majority of workers to pay $20 to go get a sick note when they shouldn't be potentially infecting other people because there might be a small handful of people who abuse the system? Let's address that in other ways, but let's respect the vast majority of workers who shouldn't be going to a doctor's office when they're sick simply to get a sick note.
Yeah, and I don't disagree with you, Mike. I mean, I'll be honest with you. I mean, I got a personal story about this. I mean, I got fired because I actually didn't get a sick note. I did get a sick note, but it only lasted for the one day, and I ended up having some sort of a neurological issue. And apparently, like I said, only lasted for the one day. Ended up getting fired from a particular company that basically said, you know what, you're not going to be coming back anymore because of the fact that you don't have an extended sick note. So it's not like I disagree with you or anything like that. I'm just kind of playing the devil's advocate, if you will.
No, I appreciate that. And I mean, your story, Brandon, is, exactly the kinds of stories that have, given me the incentive to put forward this private member's bill, because nobody should be penalized. No worker should be penalized, lose their job because they're sick, and they do the responsible thing and not go to the doctor's office and potentially infect other people. Or in some cases, you might even be too sick. In your case, it's not like you might even have been too sick to be going continually to the doctor's office simply to get a note when you'd be much healthier, much better off, better for society, the rest of the community, for you just to stay home and get better.
Now, just as a side note, once again, playing the devil's advocate here, can't doctor's notes be faxed?
Well, certainly the doctor can fax a note to the employer, but the doctor still will need to give you an assessment to verify that you're actually sick, and I don't think they can do the assessment by fax.
No, I don't think so either. So you would say that extended sick leave would probably be like the recommendation. For example, if somebody, because here I think where I work here, I think we have 10 or 15 sick days that we're allowed to use, or something along those lines. And if those run out, once again, you would probably recommend that extended leave would probably be the best for those who do have sick days, or even those who don't have sick days.
Yeah, absolutely. I mean, if you have some sort of condition that requires you to be away from work for an extended period of time, then looking at some sort of short-term leave or extended sick leave or short-term disability. I mean, there are other options that you can explore to address an extended illness.
So what does the solution look like for you here? Is just kind of get rid of the bill altogether here, or get rid of the act altogether, and just once again not have required sick notes for anybody who's sick?
Yeah, so my private member's bill is very simple. It's essentially one page, and it just removes the requirement that somebody, get a sick note from a trained medical professional when they're ill, and just to say that an employer is not allowed to require that. So it's a very simple change to the Employment Standards Act. I think there's, the feedback I've received so far is I think there's widespread across the board support for this, and I'm reaching out to other parties. I've had conversations with members of the Conservative, Liberal, NDP party, all saying I'm bringing this forward. I'm hoping to get support from all parties on this one because it's just really a common sense change to the Employment Standards Act, and it essentially makes permanent what we've temporarily done during this pandemic. But like I said, that temporary change expires in January, and I can tell you why. You know what? This pandemic's going to be going on for a while. We don't know what other kinds of pandemics are going to emerge, but at the bottom line, we want people to be safe and healthy, and we don't want people out spreading disease while getting a sick note at a doctor's office.
Mike, I appreciate the time you took me this afternoon. Thank you so much.
Hey, anytime, Brandon.
Kitchener Today with Brian Burke. Weekdays beginning at noon on 570 News.